Mrs. Fee is a 56-year-old female. She is a retired nurse who lives at home with her husband. Her husband is a doctor and works long hours. Prior to her stroke, the patient liked to attend a book club with her friends. She also has a 3-month-old granddaughter and expresses a substantial desire to be able to talk to her. Patient reports to have had heart problems. Patient had a brain hemorrhagic stroke on August 6, 2014, and presents with right-sided weakness. Spouse reports the CT scan revealed massive brain bleeding in the left side of the brain. On August 11, 2014, a craniotomy was performed after an occurrence of brain bleeding. The clot was surgically removed on August 11, 2014, and patient remained in the hospital for 2 months. Patient received speech therapy services in inpatient hospital and outpatient clinic. Some vision problems caused by the stroke were corrected with glasses. Patient has been receiving occupational therapy and physical therapy to address right-sided weakness. Patient presents with expressive receptive aphasia and global aphasia. Patient has difficulty communicating wants and needs, secondary to left subarachnoid hemorrhage. Spouse reports that patient has word-finding difficulties, expressive and receptive language difficulties. Client presents with a lot of neologisms that increase frustration. Patient has received intensive speech therapy for the past 2 years but has made very little progress. It is recommended at this point that the patient is fitted for an AAC device. The Boston Diagnosis Exam short form revealed aphasia, expressive and receptive. Cognition and memory orientation were evaluated through informal assessment. Mild impairments were shown in cognition and memory. Patient is well-oriented and aware, and patient would be a good candidate for a high-tech AAC device with touch screen. The device chosen for this patient is a Tobii Dynavox T10. It is a high-tech aided form of communication. It functions off a touch screen and is a speech-generating device, which is very efficient. The patient does not have any access barriers, therefore the portability of the device is very convenient, weighing only in at 2 pounds. This device also has embedded speakers that can be heard anywhere. Patient expresses significant willingness and motivation to learn how to use the device. Her husband is very supportive of the Dynavox device and has expressed exceptional effort in being patient and responsive to her. Patient uses direct selection, both iconic and non-iconic symbols. also uses the built-in keyboard. An evidence-based practice includes a study following the benefits individuals with communication disorders receive from the use of an AAC device. The research shows nonverbal and non-fluent aphasics enhancing their communication by using an AAC device. Another study shows that the before and after use of an AAC device improving a severe person with aphasia's communication from pre to post treatment. References include the American Speech and Language Hearing Association, as well as articles from Aphasiology and Augmentative and Attentive Communication.